Assalamualaikum warahmatullahi wabarakatuh. We are from Group 2 that we're presenting about the infection of Exanthems, and this is our group members.
Exanthems are widespread skin rashes that often occur as a manifestation of infectious disease and may be accompanied by fever, systemic symptom, or mucosal lesion known as exanthem. They are commonly seen in children but can affect individuals of all ages. Infectious exanthem can be caused by various microorganisms, including viruses, bacteria, parasites, and helminths, with viral infections being the most common cause. Recognizing the disease associated with exanthem is important because different infections can produce similar rash patterns, and accurate diagnosis is essential for appropriate management, infection control, and prevention of disease transmission. Therefore, understanding the common diseases that cause exanthem is an important aspect of clinical practice. Here are the list of common viruses that cause exanthem. First, we have varicella zoster virus that cause chickenpox and also shingles. We also have Epstein-Barr virus that cause infectious mononucleosis. We also have cytomegalovirus infection that caused by cytomegalovirus. Next, we have Rosella infectum that caused by HHV6 and also HHV7. We also have parvovirus B19 that causes erythema infectiosum. And lastly, we have rubiola that causes measles. We look at the common bacteria that cause exanthem. First, we have Streptococcus pyogenes that cause scarlet fever, Treponema pallidum that cause secondary syphilis, Neisseria meningitidis that cause meningococcemia, toxic shock syndrome that might cause by Staphylococcus aureus or Streptococcus pyogenes, and lastly we have Mycoplasma pneumonia that cause Mycoplasma pneumonia infection. Next, we will look at the common diseases that cause exanthem mainly on the virus part only. First, we have measles or rubiola that caused by measles virus. It is a highly contagious viral infection. It might present with fever, cough, coryza, conjunctivitis, and also Koplik spike. The characteristic of the rash is it will appear red maculopapular rash, start on the face, and then it will spread downward. And then we have infectious mononucleosis that caused by Epstein-Barr virus. It will associate with fever, sore throat, and also lymphadenopathy. It might cause generalized maculopapular rash, and the rash is more common after taking ampicillin or amoxicillin administration. Next, lastly, we have chickenpox that caused by varicella zoster virus. It is common childhood infection. It will produce itchy vesicular rash that appear as dewdrop on a rose petal rash. The lesion will appear in different stages simultaneously.
So next, I'm going to move on to the pathogenesis and also epidemiology of those diseases. So the first one is measles. So measles, or known as rubella, the epidemiology of it will caused by the measles virus, a highly contagious RNA virus, that transmitted through the respiratory droplets and able spread from the infected individual. It is common among unvaccinated children, although outbreaks can occur in any age group with the low vaccination coverage. The incubation period is approximately 10 to 14 days. The vaccination with the MR vaccine has significantly reduced global incidence, but the outbreaks still occur in areas with inadequate immunization. So next, I'm going to talk about the pathogenesis of the measles. So first one, the virus will enter the body through the respiratory tract, and it will replicate in the respiratory epithelium and local lymphatic tissues. The virus will spread via the bloodstream or viremia to multiple organs and tissue, and then it will infect endothelial cells, epithelial cells, and immune cells. The characteristic rash develops when T lymphocyte mount an immune response against viral infected cells in the skin. Therefore, the exanthem is mainly immune-mediated rather than caused by direct viral destruction of skin cells. So this will result in erythematous maculopapular rash, which begins on the face and behind the ear, and then will spread down to the trunk and extremities, or known as the cephalocaudal spread. So this associates with the clumpy spot in the oral mucosa, as you can see here. Next, move on to the second disease, which is chickenpox, or known as varicella. So the epidemiology of the chickenpox is caused by the varicella zoster virus, or known as VZV, a herpesvirus. It was transmitted by the respiratory droplets and direct contact with the vesicular fluid. So its most common affect the children, although adults may develop more severe disease. It is highly contagious, especially from 1 to 2 days before rash onset until all lesions have crusted. The incidence has decreased significantly due to routine varicella vaccination. So basically, this is one of the treatment of the chickenpox disease. So next, I'm going to talk about the pathogenesis of the chickenpox. So the first one, the VZV virus will enter through the respiratory tract. Then the virus will replicate in the vaginal lymph node. Then the primary viremia spread the virus throughout the body, while the secondary viremia transport the virus to the skin. Then the VZV virus will directly infect the epidermal keratinocyte. So this replication will cause the ballooning degeneration of keratinocyte. Then it will cause cell lysis and inflammation. And lastly, formation of the intraepidermal vesicles. Unlike the MERS, the skin lesion result mainly from direct viral damage to the epidermal cell. So next, so the resulting rash from this disease will cause vesicle on the erythematous space, or called as the dewdrop on the rose petal, as you can see here. So the lesion appear in successive coughs, and also the different stages coexist simultaneously, such as macules, papules, and also vesicle and crust, like this. Disease. It is common among the adolescents and young adults. More than 90% of adults worldwide have evidence of previous EBV infection. So the virus will establish lifelong latency in B lymphocyte after primary infection. So next, the pathogenesis of this disease. First, the EBV will enter through the oropharyngeal epithelium, and then will infect and replicates within the B lymphocyte. And then the infected B cells will proliferate and stimulate a strong T cell immune response. And then the clinical manifestation such as fever, lymphadenopathy, and pharyngitis result largely from this immune response. The exanthem may occur through two mechanisms. So the first one is viral-associated rash, whereas the immune response directed against the AV-infected B lymphocyte lead to a mild generalized skin eruption. And also the rash is therefore mainly immune-mediated. Next, the second one, ampicillin and amoxicillin-associated rash. The administration of ampicillin or amoxicillin drug during the acute ABV infection frequently trigger a widespread maculopapular rash. So this reaction is believed to result from altered immune reactivity during active ABV infection rather than a true drug allergy. So the resulting rash from this disease is generalized morbilliform, or called as maculopapular eruption. Is actually more common following exposure to aminopenicillin antibiotics.
Apart from that, I will explain the management of the disease. The most important preventive for measles is immunization with MMR vaccine, which protect against measles, mumps, and rubella. Vaccination is highly effective in preventing infection and reducing the spread of the disease. Next, for chickenpox, patients should be isolated to prevent transmission because the disease is highly contagious. Vaccination is also important. The chickenpox vaccine is about 80% effective in preventing symptomatic varicella zoster virus infection. However, a small percentage, which 5% of vaccinated children, may still develop rash. Symptomatic treatment is used to relieve any discomfort. For example, antihistamine lotion can help reduce itching and avoid antipyretic such as aspirin because it can increase the risk of the Reye syndrome. Reye syndrome is a rare but serious condition that can affect the liver and brain. Antiviral medication also may be prescribed. These drugs are most effective if given within 24 hours of the onset of the symptoms, as they can reduce the severity and duration of the illness. For management of infectious mononucleosis, which is commonly caused by the Epstein-Barr virus, consists of non-pharmacologic treatment and pharmacologic treatment. First, non-pharmacologic management focus on the supportive care which patients are advised to get adequate rest and sleep. This should also maintain good hydration and adequate nutrition to support recovery. For pharmacologic management, it is important to stop amoxicillin or ampicillin if they have been prescribed because this antibiotic can cause a symptom rash in patients with infectious mononucleosis. Non-steroidal anti-inflammatory drug or NSAIDs such as ibuprofen may be used to relieve fever, muscle ache, and joint discomfort. If the patient experiences itching due to a rash, antihistamine can be given to help relieve the itching. In severe cases, corticosteroid may be prescribed. These are used to reduce significant joint inflammation and swelling where there is a risk of airway obstruction.
Next, I would like to talk about the prevention of exanthem with the Islamic practices. First one is tahara or ritual hygiene. The ayah that we took is from Surah Al-Baqarah, verse 222. Indeed, Allah loves who are constantly repentant and loves those who purify themselves. Tahara involves practices such as wudu, bathing, oral hygiene, keeping the surroundings and our clothing clean. So these practices will help remove the germ from our body and environment to reduce the risk of infection. For the exanthems disease, like measles and chickenpox, the infectious droplets can contaminate our skin, our hands, the surfaces, and also our clothing. So, by doing the regular hygiene, we can reduce this risk and also reduce the spread of infection and this pathogen that provide a better health for the community. So, this is the medical intervention. We took a dalil from Sunan Abu Dawud talking about, O servants of Allah, seek treatment, for Allah has not created a disease except that He has also created its cure. To be example is vaccination. Vaccination is one of the most common effective method to protect against a serious disease such as measles and rubella. In addition, practices such as the early diagnosis, seeking medical treatment timely, and doing a regular monitoring can also help in reducing the risk of infection, reducing the risk of getting a serious complication, and also give a protection to individuals and also community. Last but not least, for prevention of exanthem is about immune resilience. We took a dalil from Sahih Muslim. A strong believer is more better and loved by Allah rather than a weak believer, while there is a good in both. Sahih Muslim. So a good immune resilience will help the body respond more effectively on a virus infection. Thus, Islamic teaching taught us on a lot how to increase this immune resilience. So, Islamic teaching encouraged us on getting a balanced nutrition, moderately eating, getting adequate rest, avoid harmful substances, and also regular physical activity. All of this activity which will help in increasing our healthy immune system. A balanced nutrition and sufficient sleep helps in strengthening our healthy immune system while also maintaining the physical and mental well-being of an individual. This will help in reducing the risk of getting the exanthems infection. A balanced nutrition and a sufficient sleep will help in strengthening our healthy immune function while also maintaining a physical and mental well-being of an individual, thus reducing the risk of getting the exanthems infections.
This is the list of references that we use.
That is all from us. Thank you.